What happens to Mick, our 56-year-old teacher, is an everyday occurrence, and this story describes how an electronic referral service of the future could support a typical pathway which results from a visit to his GP. Mick experiences a bit of a funny turn while lifting boxes and decides to see his GP to put his mind at rest. Dr. Singh examines Mick and finds nothing abnormal, but would like to have an ECG carried out. The service displays a list of options, and the doctor asks Mick if he has any preference about where he wants to go. Mick replies, "Wherever you think best." Dr. Singh wants to know the result as quickly as possible, so he helps Mick to find and book an appointment for that same afternoon at a local independent clinic. Mick asks for a printout of the confirmation and the accompanying map. Dr. Singh then hands Mick all the information about when and where he needs to go. Mick arrives for his ECG. The test is carried out. Dr. Singh is notified that his patient's test results are now available within his clinical system. On reviewing the ECG results, Dr. Singh is concerned that there is something not quite right, and he would like another opinion about what to do next given Mick's past medical history. Dr. Singh, using the results from the initial ECG test, asks a consultant cardiologist whether Mick should be seen by a specialist. The consultant cardiologist, Dr. Harrison, feels she needs more information, particularly any previous ECG results, and asks for these to be sent to her. Dr. Singh asks his secretary to upload all the relevant sections and test results from Mick's clinical record for the consultant. Having reviewed this new information, Dr. Harrison decides that Mick needs to be seen by a specialist. Dr. Singh calls Mick to give him the news that he will need to see a cardiologist and asks if he has any preference as to where he would like to go. Mick is happy to be advised by Dr. Singh, who then looks on the NHS e-referral service and finds 3 local hospitals with suitable services. All 3 services require an exercise ECG to have been done prior to the appointment, so Dr. Singh adds a request for the test and tells Mick he will need to book both appointments. If he wanted to, Mick could book the appointments now, but he would rather discuss these with his wife first, so Dr. Singh agrees to email him the necessary booking information. The vision for an NHS e-referral service is to enable NHS services available 7 days a week, more choice, greater patient involvement, and improved outcomes, making the NHS easier to do business with. Find out more by contacting us via our mailbox or take a look at our website.